All right, well, welcome everyone. Thank you for hopping on. So I am Sarah Wiseman. Hopefully you've seen my face before. I'm sorry it's blurry because my camera's been acting really weird. But I'm your chronic condition manager and I help Jamila with a lot of the wellness programs materials. Today we are going to be talking about men's health. Before I get started, just a quick shout out on as far as like we are Everside Health that we run the doc, but we are transitioning to Marathon Health, and so that's going to be going on over the next rest of this year. So if you start seeing Marathon Health, it's still the same doc, still the same everything, but just going by Marathon now. But today we are talking about men's health, and so if my quick disclaimer, if you have any questions, a great place to start would be your provider. This is provided for educational purposes. You should always seek the advice of your provider. They might have something more specific for you, kind of taking into consideration everything you have going on. So it's not to say that this should override anything your provider discusses with you or anything that they say that's more specific for you. But today we're going to be talking about chronic health conditions, more prevalent with men and male-specific health challenges, and just empowering men to take charge of their health too. So the big things we're going to be discussing and kind of diving into more for those common health concerns for men are going to be looking at prostate enlargement or BPH, prostate cancer, erectile dysfunction, and low testosterone. But just a quick poll question, throw it in the chat if you want, but out of these, what do you think is the average life expectancy for men or people born male here? 81.1 years, 76.1 years, 73.6 years, 69.3. Get the Jeopardy music going. 76.1 on one, 69.3, 76.1, 81.1. The guess is going. Good. Give me 5 more seconds here. And your answer is 76.1. So most of you got it right. The female life expectancy is 81.1 years. So you're looking at a 5-year difference between males and females on life expectancy and just expected age. So leading causes of death in men on average live a little bit shorter than women, but the top leading causes of death we're starting out are pretty similar. I mean, heart disease and cancer are 2 of the top leading causes of death in women. So no differences there majorly. But then unintentional injuries jumps up to number 3. And we'll look at those later in the presentation as well. But number 4 is that chronic respiratory diseases, lower respiratory diseases. 5 is stroke, diabetes. Number 6, Alzheimer's disease, then suicide, chronic liver disease, and then kidney disease. So heart disease being the leading cause of death among men. This is pretty much the same across across men and women here, but coronary artery disease is the most common type of heart disease. It occurs when the arteries that supply blood to the heart become hardened and narrowed from plaque buildup. So plaque's going to be that combination of cholesterol and lipids. One of the main labs that we draw for you at biometric screens, but then also when you go to see your primary care provider each year, one of the main labs they're going to draw is your lipid panel, which is looking at total cholesterol, which is a combination of HDL and LDL plus 20% of your triglycerides. More to come on the next slide. But you get this combination of the lipids and the cholesterol, the plaque builds up, blood flow to the heart is reduced, which reduces oxygen to the heart muscle. This can lead to a heart attack or other heart conditions. The major risk factors for heart disease are diabetes, cholesterol, and blood pressure. So to help remember this, we call it the ABCs. A1C for diabetes, that's measuring our blood sugars. B, blood pressure. So you see over here, high blood pressure is over here. Cholesterol is C, so low HDL, which is the good cholesterol. That's going to be a risk factor. High LDL, which we don't want. That's the bad cholesterol. So our cholesterol is number C. And then S is sometimes added as smoking. You have a 3 times higher risk of heart disease with smoking because it makes the plaque more sticky to the artery wall. So it just makes it so that the cholesterol raises more. It can also impact blood pressure. So it's impacting other conditions as well. It can also increase your risk for diabetes. So the smoking itself is increasing the risk for heart disease, but increasing the risk for other conditions that contribute to heart disease as well. You're also at a higher risk if you have a first-degree relative with cardiovascular disease, and this is based on age. So if they were diagnosed with cardiovascular disease or any heart disease, for men under the age of 55, for women, it's less than 65 years of age. As we age, that's a risk factor for heart disease. So we don't really look at it as a high risk if you're diagnosed over those ages. Obesity and weight gain is also a risk factor, and activity, and then advancing age is one of those too, as well as some other factors. So heart disease has an increased risk with this advancing age. And so for 40 to 50-year-olds, our risk without any other risk factors accounted in that is 2%. For those 51 to 60 years old, 3.5%. For 61 to 70-year-olds, that's 7.1%. So you see it increases pretty significantly to the point we get to 91 to 100-year-olds, your risk is 32.5%. So the more we can take advantage of like lifestyle factors and things like that, especially as we're aging, the better we're going to help prevent heart disease risk. So what can we do? Physical activity is one of the biggest things. Staying active throughout the day. And that can include exercise, but just moving more in general, fidgeting, non-exercise activity, thermogenesis, or what we call NEAT, basically you're fidgeting. That helps a lot. Nutrition we look at a lot. So sometimes we think about what we shouldn't have, like fried foods, fatty foods, high sugary foods, but also increasing our intake of fruits, vegetables, nuts, whole grains, that fiber, all of these nutrients. Unsaturated fats, those can help reduce our risk for heart disease as well. Medications and making sure you're taking your medications if those are needed. That's a conversation with your provider. Avoiding or stopping smoking, maintaining a healthy weight, monitoring blood pressure and blood sugar, regular exams. What's not on here is also looking at alcohol intake, but also sleep. Sleep is a big indicator that the American Heart Association just came out with. Life's Essential 8. Sleep is one of those factors they're looking at now, and making sure you're getting plenty of sleep and getting good quality of sleep. So moving on from heart disease, cancer is the second leading cause of death in men in the United States. This is where it starts to differ from women a good bit. So lung, colorectal, prostate, and skin cancer are the most common types of cancer for men. Colorectal is one of the biggest one for women, but lung and prostate prostate especially is not going to be in there. But if you look at these cancer cases, so the most common types of cancer are on top. These are going to be how many cases we have. The bottom is not necessarily, they don't actually line up. So like the most common type of cancer is prostate cancer, but that's not the leading cause of death from cancer for men. So prostate's more common, but it's not as fatal as lung cancer. Colorectal cancer is number 3 on both. So these are the 3 big ones, but lung cancer really tends to be more of a concern than prostate cancer when it comes to death. That being said, U.S. Preventative Task Force, Preventative Services Task Force they put out recommendations as far as preventative screenings and what's recommended. They have grades of screenings. So grade A is the highest grade of screening where it's the most amount of evidence to back it. Grade B, there's a good amount of evidence, but it's just not quite as strong as that grade A. So grade B recommendation that all patients between the age of 50 and 80 years old with a smoking history of 20 pack years or more, 20 packs per year or more, should have a low dose lung CT annually. You also must be a current smoker. So this could also be if you are a current smoker or have quit within the past 15 years, you should have that screening. Screening programs are offered at many local hospitals. Premier and Kettering, I believe both of them have it. I know Premier for sure does. And it's usually pretty affordable. It's not super cheap, but it's about $100. Get a lung screening and get tested. Lung cancer kills more people each year than breast, prostate, colorectal, and colorectal cancers combined. So it's the most deadly cancer. And cigarette smoking is responsible for 90% of those cases. And it is the most important modifiable risk factor we have. Stopping nicotine use, stopping tobacco use really helps. Chewing tobacco is as harmful as cigarette smoking. I think the verdict's still kind of out. We know vaping is not great either, but don't really have a specific statistics on that. But chewing tobacco can still cause 8 different types of cancer too. So best thing you can do is to stop. Colon cancer, this is a grade A recommendation, so it's even more of a recommendation than the lung cancer screenings, but for ages 50 to 75, we recommend colonoscopies or Cologuard. For those 45 to 50 years old, it's not as strong of a recommendation, but still recommended to have colonoscopies or Cologuard. It's a newer recommendation to have that age 45 as a screening, start screening at that age 45. But that's really for more select patients that are more at high risk. So it's important to have that screening though, because many people have no symptoms of colon cancer, and you may not know it until you have those later stages. So making sure you're getting screened and staying up to date on that. I know it's kind of hard to keep track of because it's like every 10 years, which is what we look at. For colonoscopies, it's every 10 years if you're negative for if you're 45 years or older. It is the gold standard is colonoscopy. Fit fecal or Cologuard is recommended mainly in those lower risk populations, but for 45 years and older, but you repeat it every 3 years, and it's an at-home test. So it's just something that you can do at home, mail in, you get the results. If you're at an average risk, this could be fine, but it's mainly going to detect the colon cancer once it's already there. If it's positive, you need to have that colonoscopy. Colonoscopy is, again, going to be that gold standard that can detect the polyps and kind of see and catch things a little bit sooner. You're going to be under sedation more often than not, and just keep you comfortable. Not high levels sedation, but you'll be comfortable. Highly recommended if you have a family history of colon cancer or personal history of colon polyps or colon cancer. And then we get into male-specific cancers like prostate cancer. Digital rectal exams are only done on select patients in primary care settings. You can also do a PSA screening, which is a blood test. It can be discussed in all men between the ages of 50 and 70. This is for people with like a 10-year or more life expectancy, essentially. PSA screenings can also be discussed earlier in people who are at a higher risk between the ages of 40 and 45. So if you're at a higher risk, they might start screening a little bit sooner. This is more like if you have a first-degree relative that was diagnosed under the age of 65 with prostate cancer, is positive for BRCA, or African Americans tend to have a higher risk as well. And then men who have the PSA screening, based on American Cancer Society recommendations, should have it every 2 years. If the PSA is greater than 2.5 nanograms per milliliter, that's kind of that marker, it should be done every year just to stay on top of it. Testicular cancer, it's pretty uncommon type of cancer, but usually it's a solid tumor. Cancer in men's aged 15 to 35, so more common in a younger age group. You have surgery to remove the affected testicle if it's present. It's typically treatable, long-term survival rate. It's diagnosed with like self-exams can help detect it sooner, but you should talk to your provider if you have lumps, masses, if you notice anything that's on one side but not the other, so that asymmetry of it's one-sided but not on the other side, letting your provider know. If you're having any pain, that's a good time to let your provider know too. They'll sometimes do an ultrasound just to help evaluate if there are any abnormalities there. And then skin cancer. We look at melanoma as one of the big causes of, it's the main type of skin cancer. So this is the one we usually look at. You can develop anywhere on your body, and you can even get it underneath clothing, even though it's more common in areas that are more exposed to the sun. So you want to watch out for a change to an existing mole or changes in pigmentations. Anything that looks unusual, if anything's gets abnormal in shape. So moles are usually uniform in color, smooth, have distinct borders. They're smaller. They're about 1/4 inch or 6 millimeters in diameter, very, very small. They can typically have a flat spot or a large bump on them, but they're one color. They're brown, they're tan, they're pink, they're blue, clear, or skin toned. They measure less than that 1/4 inch. They're round and even on both sides too, so they have that well-defined border that separates them from the rest of your skin. They don't change. That's the big thing, is they're not changing at all. So when we get into melanoma, we have the ABCDEs to help us detect it, and evolving or changing is something that's going to be important to look at. But using the ABCDEs, so A is it's asymmetrical. It doesn't have a regular shape. So if you put a line down the middle of it, it's not going to look the same on one side as the other. It can strike anyone, but certain people are going to be more likely. So Caucasians are going to be more likely to be diagnosed with melanoma. If you have blue eyes, if you have blonde hair, you know, if you look like me, you're probably going to be more likely to have skin cancer. Fair skin, redheads or blondes, again, blue, green eyes, you're significantly higher risk. But kind of moving on through the ABCDEs, border, the border of the molar spot, if it's irregular or jagged, that's going to be more of a sign of breast melanoma. Color, uneven or irregular color, if it's changing throughout that spot, it's going to be more likely. And then the diameter, so if it's larger than the size of a pea or larger than the size of a pencil eraser, that's going to be an indicator as well. Prevention, you want to avoid the sun during the middle of the day, especially. So getting sunlight exposure is important for vitamin D, but really you can get a lot of vitamin D through just 15 minutes of sunlight exposure. So getting that outside of the midday sun hours, where it's going to be the most direct sunlight, is really important. Wearing sunscreen with an SPF 30 or higher and reapplying every 2 hours. Wearing protective clothing. Often that's listed on the tag or the label if it has the SPF protection. You can use a wide brimmed hat, kind of like what he's wearing. Check your skin regularly and notice if you have any abnormal spots or changes to existing moles. Talking to your primary care provider or dermatologist to check your skin annually or more often if needed. And if you think you have melanoma, make sure you get in touch with your provider. They can obtain a biopsy and send a sample to the lab. And if it is diagnosed, then they'll remove that spot completely. They try to get rid of all of it so that it's not going to spread. It's usually performed by a surgeon, so it would be a surgery. They might do the biopsy is not a surgery, but removing that spot will be a surgery. And then the lymph node biopsy might be recommended to ensure that that melanoma has not already spread. So they'll check any lymph nodes and things like that. And then prevention. So ideally we'll prevent our cancer and not get any cancer to begin with. And so that's the best way to start, is preventing it from the start. The best way to do that is to stay up to date on screenings and preventative exams. We can't prevent everything, but the sooner we catch it, usually it's more treatable and it's easier to take care of and more cost effective. It's not going to cost you as much. It's not going to take as much time. Tobacco products is the next thing. So making sure you're staying away from any tobacco products or nicotine, limiting the amount of alcohol that you consume, making sure you're getting sun protection if you're outside, getting regular physical activity. Again, that healthy diet, high in fruits, vegetables, whole grains, these provide a lot of antioxidants that help protect against cancer. Low and high sugary foods, high fat foods, and fried foods, and then maintaining that healthy weight. And ultimately, we know genetics plays a large role in all of this. And so you're not going to be able to prevent cancer every single time. Family history is going to play a big role, but knowing your family history, discussing it with your provider so that you know which group you fall in based off of risk factors. I have a high family risk of colon cancer, so I know it's something I have to stay on top of, and I might need to stay more with that screening and wouldn't necessarily be able to do the Cologuard. That's something important to know for yourself so that you can talk about that with your provider. All right. Getting into some more male-specific concerns to benign prostatic hyperplasia, BPH. This on the left is a normal prostate and a normal bladder. So as you're looking through, the urine can go through pretty easily, not impaired. The prostate surrounding the whole urethra where the urine comes out. So if you have issues, if your prostate's enlarged, you have a narrowing of this urethra, and so now it's going to be harder for the urine to get out. So you will have probably trouble starting to stream, dribbling issues, not feeling like you've completely voided. That's typically some of your major signs that you have an enlarged prostate. So with prostate, the main function is to create that seminal fluid that nourishes and transports sperm. It commonly gets larger with age. And so somebody, as we age, as men age, the prostate's going to get larger. The size of the prostate doesn't necessarily correspond with the severity of the symptoms. But typically, again, that dribbling and ability to empty the bladder, weak urinary system, difficulty starting to stream, those are going to be your main symptoms. BPH, or benign prostatic hyperplasia, the symptoms might be more than just one condition. So they're going to try to rule some things out, like urinary tract infection, if you have an inflammation of the prostate or just prostatitis, urethral stricture, or narrowing of the urethra, bladder or kidney stones, or bladder or kidney cancer. We'll rule those out first. They can make a diagnosis based on the symptoms, and you can treat based on the symptoms. You don't always need to have that biopsy, but they might do a biopsy just if they have a suspicion for cancer. But it doesn't always have to have that histological or biopsy kind of confirmation for it. Some of their concerns and why they wouldn't maybe do a biopsy is if they notice an asymmetry on that prostate, so something that's on one side but not on the other, or just an increasing PSA, so that lab draw that they do to test for prostate cancer. Get the right words out. Treatment options, there's a lot of different medications that they can diagnose, that they can treat with. They might do surgery. There's a lot of minimally invasive therapies now too that they can do to help kind of shrink down the prostate. So minimally invasive doesn't require surgery. So not as problematic. So going back to our different causes of death, our third cause of death leading cause of death for men is unintentional injuries. And half of all of these unintentional injuries are caused by accidental drug overdoses. So this comes back to like taking care of mental health and making sure that you're on top of your own mental health. And if you are having issues with drug use, alcohol use, or if you know somebody that is, making sure they have access to the addiction treatments, counseling, and the tools they need to help reduce these types of deaths. Moving on to erectile dysfunction, so not a leading cause of death by any means, but also a common concern for men. It is the inability to keep an erection firm enough for sex. And having an erection trouble once in a while isn't necessarily a concern, but if it keeps happening, then it's something to talk to your provider about. It's common even in people in their 30s. There's many causes for it. It can be a sign of underlying health conditions and can be associated with heart disease. Some of these risk factors, depression is a large cause, stress, anxiety, heart disease, atherosclerosis, high cholesterol, high blood pressure, diabetes, low testosterone. Tobacco use can be a large cause for erectile dysfunction, especially in people that are younger as well. Some medications can cause issues. One of these medications is some depression medications. So yes, depression can have issues, can lead to issues with erectile dysfunction, but some of the medications we use to treat can cause issues. So it's just something to keep that conversation in mind with your provider, and just let them know, because it's not like there's nothing that you can do from there. Alcoholism, other substance abuse, inactivity, tobacco use, obesity, all risk factors. So prevention, again, first and foremost, avoiding tobacco, getting regular exercise, making sure that you're following a nutritious diet that's well-rounded, low fat, high in these fiber, high in nutrients, keeping alcohol intake to a minimum. So moderate intake for men, 2 drinks a day or less, avoiding illicit drugs. And then if you are having mental health concerns, making sure that you seek help for those mental health concerns and have that conversation again with your primary care provider if you're concerned with some of these different medications having issues with that. So, but before we do anything too, it's important to treat any underlying health conditions before you start adding treatments to it. Talking to your provider and treating those conditions, because treatments, there's always side effects for everything. So you want to make sure that you're taking care of the first things first. And if you are having issues with managing blood sugar, blood pressure, cholesterol, that can be an easy fix before you go to some of these other things. But there are oral medications, Viagra, Cialis, Vardenafil. Then there's injections. So it's a small needle for a Prostadil, and you inject that into the base of the penis. There's a penis pump, penile implants, and then as a last resort, the penile implants, that involves surgery. So that's a last resort sort of thing. And then testosterone, the main kind of cause we'll look at for this is male hypogonadism. And symptoms of low testosterone, though, decreased sex drive, fatigue, depression. Over time, it can lead to that erectile dysfunction, infertility, decreased muscle mass, hair growth, bone mass, decreased bone mass. Testosterone does have a protective effect on bone, but it does decrease with age naturally. And a lot of times the symptoms of low testosterone can be confused with other conditions. So it's important to test and get an actual test for it. It can develop at birth or can develop later in life. And again, we'll focus more on that hypogonadism in an adult, but our symptoms are there as well. So causes, primary cause, the testicles fail to produce enough testosterone, but it really begins in that hypothalamus or the pituitary gland to trigger that testosterone release too. So risk factors: having HIV or AIDS, a history of chemotherapy or radiation therapy, aging, obesity, and if you are not getting the nutrients you need or are malnourished. So it's diagnosed through blood work. Typically, the blood work should be drawn between 8 and 10 a.m. and should be low on 2 separate occasions. Blood draws are often used, again, that's diagnosis method. And you might draw additional labs to distinguish between the primary and secondary causes of low testosterone. It's not well absorbed in the stomach, so usually the treatment is it's not oral, so it's gels, injections, patches, or nasal therapies. The topical gels tend to be more expensive, and that's more applied to the skin. Injections are usually every 2 to 10 weeks, and depending on the brand, you can have patches, gums, or nasal injections as well. It is a controlled substance, so something to keep in mind there too. I know our providers will typically refer you out after an initial low testosterone to a urologist to treat with that too. So with that, all of that, here is all of our topics from the day here as far as overview, knowing your numbers, cancer screenings, making sure that you are staying on top of some of the bigger things like heart disease, cancer, and prostate health, staying nutritious, eating nutritious food, staying active, not using tobacco, staying healthy, and then talking to your provider if you're having any of these concerns, getting your annual wellness exam. They are going to be more of the expert to talk about all of this. I know our company has graciously helped to put this presentation together, but thinking through what are some things that you can do to incorporate from today's webinar to help keep you being healthy and moving forward. Eating more vegetables, scheduling time with physical activity, maybe cutting back on tobacco, using sun protection, even in the wintertime, limiting alcohol use. Maybe it's reaching out to your provider, your own primary care provider, or your now Marathon Health provider within the next week or so to talk about some of these things. Again, you can talk to your provider about any screening options, anything you might need. This is some of the things that they'll talk about during your annual exam too, just to make sure you're staying on top of screenings, staying on top of all of your labs, if any other concerns like this might come up, as far as like if low testosterone, if you're having concerns with sleep or things like that. There's other resources on Community Care Connect. Another way to go about this is findhelp.org. There's resources for sexual and reproductive health, support groups, education and training, recovery services, peer programs for men and teens as well. With that said, any questions?